Health Minister Dr Joe Phaahla has confirmed the first cholera-related death in South Africa. The minister says the number of laboratory-confirmed cases has now risen to 5. The patient who passed away was a 24-year-old man from Emandleni in Wattville, Benoni. He had no travel history, and the department says the patient had suffered with diarrhea when he was admitted to Tambo Memorial Hospital. Well, the department has also said that one of his contacts is still in hospital and further investigations are being conducted. Let's get more on this first cholera death in South Africa from the Deputy Health Minister, Dr. Sibongiseni Dhlomo. A very good evening to you, Doctor. Thank you for your time. So how unusual is it for someone to die of cholera in present-day South Africa?
Thank you very much. Good evening, and good evening to your viewers. Yeah, we are no more an endemic. We're not having really a cholera endemic part in our country. We do have our neighbors still having that as a problem. Hence, you do notice, by the way, just to report, of those 3 cases that came from Malawi into our country, they've all fully recovered. Now, not having cholera in South Africa does not mean that we may probably not have me, and as a carrier, that if I still do not practice personal hygiene and therefore it's a fecal contamination with water or food, I may still pass it on to myself or to any other person, and therefore these cases we are not able to link them. One is in Alexander, the 4th case who actually is survived, and the one that has passed on is the one that you have mentioned, Tembekile in Benoni, Wattville. So the cases are not yet related according to our findings, but because we are continuously saying, if you do notice continued diarrhea for 2-3 days, please let us be seen in the facility, and therefore stools will be taken and be tested, and if cholera is actually found, we will then report it. But however, we can still be able to manage and treat, because it's a treatable, before being preventable, it's also treatable, and we do have a lot of people who survive even though they contract cholera.
And this 24-year-old man who sadly died in Wattville, Benoni had no history of recent travel. Does that mean that cholera may be spreading from a water source in South Africa?
We probably need to be much more vigilant, Tembekile, because of the climate change, the floods, and too much water, too much rain, and maybe some pipes bursting, and the possibility of mixing water with some fecal contamination. We may be getting more and more of that, but maybe it is related to a personal hygiene that we need to also keep on working on it. So if we do find water source that we are probably not very sure of, we would rather err on the side of boiling that water. But if there's not electricity available, other experts have told us that if you put in jik in that water, it is safe for use, rather than maybe just continue to use water where the source might probably be a contaminated source.
So if there is a contaminated source, Dr. Dhlomo, am I right to say that, for example, if it was water that people were getting from a burst pipe or from a river where cholera was present, there would likely be perhaps a larger outbreak in the said community?
Possibly, there could be. So that is why we will be very vigilant, go closer to that family. It probably may just be, if I'm the one, Tembekile, in this house and I brought water into the house, but I'm the one affected, let's get to check closely within the family members. Did we get the water from a contaminated source? Maybe did we boil it or did we not? Did we put jik in it? So we will be following up the close contacts. But you are correct, if it is maybe a burst pipe and most people in that community are using that water, probably not boiled, not jik in it, then we'll have a bigger outbreak than just one isolated case in Wattville as we speak about it now.
And just on the issue of water, recently we know that from last year we've had multiple reports in Gauteng in particular where municipalities did not have enough water to supply at the rate at which people were consuming because load shedding was affecting the ability to prepare water for ultimate consumption at tap level. Could that put us at risk if the quality of the water coming out of our taps isn't great? Could that put us at risk of a further spread of cholera?
Yes, that is why municipalities always have what we call health inspectors to make sure that what we give to citizens is not contaminated water. That is actually a prerequisite for the health inspectors in municipalities. But you are correct, with the continued rains and probably water bursting and maybe people getting a source of water not being the proper one with the contamination, it could be. So we would rather err on the side of, yes, there's no electricity, we can't boil water. Maybe if you are suspicious of a contaminated water source, maybe to use jig in that water, it will actually go a long way towards killing the cholera bacteria within that water source or within that yeah.
Let's go back for a moment then to the gentleman who has sadly died in Wattville from cholera. I'd like to get a sense of how treatable cholera is at hospital level.
We do know, we do notice that if you come in, even before we know it's cholera, Tembekile, we put a drip on you and we really rehydrate you, because the commonest cause of death is dehydration with vomiting and losing a lot of water through diarrhea. So when they get into hospitals, we start them on the drips, push as much as we can fluids. When probably some of them are unconscious, not able to take by mouth, we give them drips while we start them on another anti-cholera treatment, tetracycline. They do survive, they really do. It's only when they come in severely dehydrated that we probably miss out and then but it is still a treatable, besides being preventable, it is treatable, it's a treatable cause of death. Yeah, it is a treatable disease.
And I'm listening to you, Deputy Minister, talk about the more obvious symptoms, be it the intense vomiting, diarrhea, for example. People suffer from those for multiple other reasons. Some may have had a rough night out. You may have had food poisoning, a reaction to something that you've eaten. So when should we worry and say, perhaps I need to present myself at a hospital, at a clinic?
We rather look at what's diarrhea. Diarrhea is just more than, normally most people will go to a bathroom, a toilet once a day, and that's done. But if you go twice, then probably that is the beginning of diarrhea. But if you go 5 times, then there's something to worry. And accompanied by 3 times of vomiting in a day, please do not ignore that. But you are correct. If you have been to a party and something upset your tummy, that diarrhea may just be 2 or 3 stools or 3 visits to the toilet. But a continuous visit to the toilet and profuse loss of water through diarrhea and vomiting, that's an indication that you should really seek assistance in a clinic or a hospital. Because even if it's not cholera, but that is a sign of a severe loss of water in your body, you need to be seen quickly, get to be resuscitated, get drips and water, and then we could look for a cause. But after all, the cause of death and the cause of illness being cholera, we are going to pick up the next day. We will take the stool, send it to the laboratory, results will come that afternoon or the next day. But at least we would have symptomatically treated you for what you have presented with, which is something that you should not ignore. Continuous diarrhea at home with vomiting, please let us actually take care and able to report to the nearest health facility.
Deputy Health Minister Dr. Sibongiseni Dhlomo, good to have your time, sir. Thank you.